slide is just really talking about how we're moving forward, entering the new phase of the pandemic, really empowering individuals to take steps to prevent the spread of COVID-19. We're monitoring trends, different trends, looking more at hospitalizations, deaths, and outbreaks compared just to focusing on just cases and percent positivity. I encourage persons to, do three things: stay up to date on their vaccines, make sure they get their initial doses and get their booster dose, wear a mask when appropriate, especially for those who are immune compromised. The better the mask, the better the protection. So N95s, KN95s are the best. And then a person should get tested if they experience symptoms of COVID-19. So there's lots of testing options in the community. Went by the Star Med facility at Union Baptist just an hour ago. No line there. I'm sure it's the same, pretty close to the same situation at other testing sites in the county. Plus, there's now more at-home test kits available that you can purchase or through the giveaways that we have at the health department and at the libraries. Per the DHHS dashboard, we had 692 deaths on February 1st, reported 751 today. So we're almost at 60, and we're just on the 22nd. So there's a possibility that February could see more deaths than January, and that's a shorter month. So, we know that unfortunately some people that have had, and they've had COVID a long time, even more than the 2 to 3 weeks since the peak, we had the peak, or now 4 weeks since the peak of Omicron. So I think it's, the thing is, when you just look at the trends, obviously you saw today's numbers, that jump. Over the last 14 days, we've seen a 33% decrease in deaths, so a 33% decrease. So I think that is indicative of that decline, but, will there be days where we have an uptick? Could be reporting, or it just could be, unfortunately, where people have passed just because they've had COVID now. And some people could have had COVID for more than the past, over a month and have been battling it in the hospital. So I do think we're headed in the right direction. But, I guess the matter for me is where I'm thinking is how far will this go? Right now we're at 588 cases for the week of the 13th. So that, are we going to get back to where we were last June and July when it was literally 50 cases a week? Or is it going to start to level out? Now we're averaging 133 cases a day.